Hi, guys. Welcome back for our daily practice questions. As always, I like to first introduce myself and to go over my disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer and reminder is that there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here I've designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Any of the other videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 45-year-old female presents with a 1 month history of increased thirst, frequent urination, and unintentional weight loss. Her fasting blood glucose level is 175 milligrams per deciliter, and her A1C is 8.2%. Which of the following is the most likely diagnosis? Is it A, type 1 diabetes, B, type 2 diabetes, C, Cushing's disease, or D, hyperthyroidism? Take a moment and tell me what you got. All right, you guys, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what's being asked of you. So here, the stem of the question states, which of the following is the most likely diagnosis? And I tell you, if they're asking about a diagnosis, you want to run it back and look at the assessment findings to see those signs, symptoms, and the presentation. So this is a 45-year-old female who came in with a 1 month history of increased thirst, increased urination, and unintentional weight loss. And this is a portion of those three P's that we think of, like our polyphagia, our polydipsia, all of the things that are classic for the presentation of type 2 diabetes. So your best answer is B. All right, question number two. A 28-year-old female presents with a complaint of a sore throat, fever, and difficulty swallowing. Physical exam reveals tender anterior cervical lymphadenopathy and erythematous tonsils with exudate. A rapid strep test is positive. Which of the following is the most appropriate treatment? Is it A, amoxicillin, B, ceftriaxone, C, corticosteroids, or D, acetaminophen? And so here, the stem of the question states, which of the following is the most appropriate treatment? And so, if I want to tell you that if they're asking you for a treatment, you need to look back and see if they provided you with the diagnosis. And they have, letting you know that the strep test is positive, the classic presentation with that anterior cervical lymphadenopathy. So we know it's strep throat. So then you want to think of how you best treat this. So your best answer is A, amoxicillin. And then lastly, question number three, a 28-year-old female presents with fatigue, pallor, and a history of heavy menstrual periods. Her lab results reveal a hemoglobin level of 9.5, a MCV of 70, and a serum ferritin level of 12. Which of the following is the most likely diagnosis? Is it A, vitamin B12 deficiency, B, iron deficiency anemia, C, anemia of chronic disease, or D, folate deficiency anemia? Take a moment and tell me what you get. All right, so the stem of the question states, which of the following is the most likely diagnosis? So the key here is to pay attention to these lab values. This lady has already came into the office. She has fatigue, she's pale, she's complaining of heavy menstrual cycles, but her lab showing you hemoglobin, letting you know it's low, so she is anemic. But that MCV is showing you microcytic. Remember, MCVs less than 80 are considered microcytic, and then her ferritin level is also low, letting you confirm the levels. Because your ferritin levels are your iron stores, so letting you know this is B, iron deficiency anemia. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all make me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. All of the things that I do offer are linked in the bio of this channel. And if you're looking to book any of the one-on-one sessions, as always, I tell you to either call, text, or email, as I offer a variety of one-on-one session types, and I prefer to speak with you to gauge what you truly need to make sure you're booking the appropriate appointment. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.